14B.II, we'll talk about who does therapy, and we'll critique therapy and go through it a little bit. So to whom do people turn for help for psychological difficulty? Oh, man. First of all, does therapy even work? Man, why my graphs aren't working? We'll have to go over this in class. But why does therapy work? Well, in order to first make sure it does work, we use meta-analysis. This is the procedure for statistically combining the results of many different research studies that might pertain to one specific disorder. Then there's clinical psychologists. These are the people who do therapy. Most are psychologists with a PhD and expertise in research, assessment, and therapy. They're supplemented by a supervised internship. About half work in agencies and institutions, half in private practices. Clinical or psychiatric social workers. These people require a 2-year Master's of Social Work graduate program plus postgraduate supervision prepares some social workers to offer psychotherapy, mostly to people with everyday personal and family problems. About half have earned the National Association of Social Workers designation of clinical social workers. There's therapeutic counselors, like marriage counselors and family counselors who specialize in problems arising from family relationships. There's pastoral counselors who provide counseling to countless people. And abuse counselors work with substance abusers and with spouse and child abusers and their victims. And then there's psychiatrists, who are different from psychologists in that they are physicians who specialize in the treatment of psychological disorders. Not all psychiatrists have had extensive training in psychotherapy, but as a medical doctor, they can prescribe medications. Thus, they tend to see those with the most serious problems. Many have a private practice.